having qualified staff. Taking the time to get to know your patients before you treat them. Having a good budget so that you can work adequately with what your patient needs are. And taking the time to care.
Like everyone deserves equal and fair healthcare.
Being able to maintain our healthcare system with a growing population. Because right now we're not making adjustments while we have more people coming into the system as well. Because like Sarah's a nurse, so she sees how many backlogs there are, how many people are waiting for beds, how many people go in for surgeries on a wait time, and they say, oh no, we'll have you tomorrow, go home, and you sat in the hospital for 8 hours. So it helped deal with some of these wait times, especially for people that have some pretty serious conditions. So I think that really helped them out, being able to make adjustments for a growing population too.
I guess I would say, so I guess availability, maybe time, like how long it takes to get in. So how quickly things can be processed. So what was that? What did I say? Availability. And then time. I guess also personability from the professional, the medical professional. If they can't communicate well with the person, then it's just a waste of an appointment. And then I guess availability of medications and just how easily it is to get different medications in different areas, I would say.
Our patient care, right, making sure that patients have that bare minimum met, so that there are sufficient number of beds, there are sufficient numbers of nurses who are able to attend to those beds, doctors that the nurses report to, et cetera, et cetera. So having that kind of infrastructure. And then also the community part of it too, I think is important. So those, I think sometimes we think of healthcare as just like when you walk into a hospital, but oftentimes you can actually prevent a lot of those visits by educating the community, making sure that our youth, for example, are educated, they understand their own bodies, what's going on in their bodies, how to take care of small things, how to be able to recognize the difference between, a small boo-boo and a big enough ouchie to go to the hospital. So yeah, kind of those, I would say those two aspects, kind of things that happen in-house and then out-of-house stuff.
Ooh. Core principles, I would say accessibility, like making sure everyone has access to healthcare, quality healthcare, like making sure everyone has good quality healthcare, and like maybe respecting like each human's dignity, like providing, like taking care of each person and respecting who they are.
One of the biggest health challenges, I think, is, of course, like we just talked about, those growing numbers. I think another part of it is actually challenging a bit of the mistruths that are being spread about now. Since we had the era of fake news, and now we're trying to deal with it, it's awesome. But I think now people have some falsehoods about their healthcare, and about just health in general. That makes it a bit harder for it to be a two-way conversation between healthcare and the person who needs the healthcare. So I think that kind of is part of it.
Just like staffing kind of crises. I know like our healthcare system, especially after the pandemic, I have friends who are nurses and they're just completely overworked because they have to, well, there's not enough staff to like take care and see every patient, and so oftentimes they're working like multiple shifts and like lots of night shifts that just kind of drain their energy. And I think that's kind of the biggest one I've heard of as of lately. And like I think that boils down to like funding as well, the resources and like funding they have to staff themselves, make sure patients get like adequate care. Yeah.
You know, I think some of the biggest challenges are recruiting doctors to come and live in Saskatchewan and in the smaller centers in Saskatchewan. So since we are having a shortage of doctors, I think what that's doing is it's putting a lot of pressure on the healthcare. And it's blocking up the emergency system. So yeah, for those that truly need care are having to wait longer, and for those that aren't really emergency sick, could see a family doctor sick, I think those people need to find a doctor so that they don't have to take that care away from the emergency.
Canadian healthcare, I think it can be, a lot of people feel like they're kind of pushed through the healthcare system quickly. I think like in the, not to say it's better in the States, but I think in the States where you pay money to the doctor, like that almost makes them have to focus more on you. But because sometimes I think we get this idea of free healthcare as being like a, just pushing people through the doors or whatever. And then I know there's a lot of people that are either new to the country that can't get a family doctor, or people that come from communities that don't have as many family doctors available to them. I know that just anyone has issues. Everyone has issues getting a family doctor these days. Another problem would probably be, it seems to be like when we do have free healthcare, but then there's this also, you can pay in certain situations, so you do get like people that are paying money to get better healthcare, which kind of destroys the idea of free healthcare. It's like, you know, so that, I think that's about it for that one.
I think that some of the biggest challenges involve funding. So just not having healthcare be a priority for our provincial government, and seeing less and less funding go toward our healthcare system in general, especially over the last kind of 17-ish years. Just that healthcare hasn't really been a big priority because it doesn't make money. So I think that one of the biggest maybe barriers then in terms of healthcare is that it's not a progressive field. It is not something that will, or maybe not progressive isn't the right word, but it's not a place that will make you money. Much like a school, it is a resource for your citizens, not meant to make money.
If you're in excruciating pain and you are dying, I think that should be something that people consider. I think that there are situations where people might be suffering mentally, and they might think that they need to go, and I think that in those situations maybe that wouldn't be the right direction to go. I just remember hearing there's something about it's somewhere in Scandinavia, I don't know if it was Sweden or Norway, but there was talk about there was a younger woman who was really depressed, and she was asking for that, and everyone was debating whether or not that was the moral thing to do. I don't think that would be a good idea. But if someone is already dying and they're very sick and in a lot of pain, then I think that that's acceptable.
I'm all for it actually. I even think like as a single person for myself, like if I don't have kids or I don't have a partner one day, that would be something where that's something I could enter into and make like my own decisions about. Not having any family or people that were tied to me. Like for my parents, I would help them in those end of life scenarios as their child, but if I didn't have a partner or kids, who would help me? So I like made for personal reasons for myself in the future. Also, if my life ended up in a circumstance that my quality of life wasn't there, I would be interested in something like that. Because there are like huge financial costs to certain parts of healthcare, and so for me that just might be, if I couldn't take on that financial burden, maybe MAID is something that would be there.
My opinion is I think it's really hard to make a rule that fits every single case perfectly. I think it's really case to case, because if we have someone that's not able to make that decision on their own behalf for whatever reason it may be, like maybe a mental health illness, maybe they're under heavy medication, then at what point are you given a genuine consent for it too? So like I find it's a case by case basis, but I think that some people, if they got nothing left to give, we shouldn't ask them to give it.
I think that there are appropriate places for it and inappropriate places for it. For example, I don't know anyone personally who's accessed MAID, but I've read different articles of people who were quite actually excited about MAID. For example, this one story is popping out at me of a man who had like terminal cancer, and he was not going to be doing chemo or any type of therapy for his cancer because he was quite old. And he had just said, I don't want to spend my life in pain because of chemo, but I also don't want to spend my life in pain because of cancer. I would much rather be able to spend the rest of my time, even if it's a little bit shorter, with my friends and family. Maybe we could even say goodbye to each other, and then I know that this will be my time to go. And for things like that, seems pretty. It's an option for people.
But I think in terms of mental health, I think a lot more work needs to be done with this type of situation, because sometimes our brain is not working properly when we're not the healthiest that we can be mentally. And so I'm okay with it for people that are going to suffer or have a low quality of life, but I would need to do a lot of reading and a lot of research before I would be okay with it when it comes to mental health circumstances.
I guess, when I think about MAID, I think I kind of have two thoughts that coexist with each other. On the one hand, I think MAID is so important for giving people the right to choose, like if they are diagnosed with a long-term illness that is going to, like really be challenging and make them suffer tremendously. I think sometimes having the choice to take their life in their own hands is really empowering and kind of gives them an opportunity to live their life to the fullest, and kind of have control of their suffering, I guess. But on the other hand of that, I do also know my only concern is when it comes to mental health, because I know MAID was going to be, I think, extended for people with mental illness, and that does kind of concern me, because just making sure with the strain of our healthcare system, I think some people with mental illness might not be receiving the care they need, and so MAID would be a more accessible, well, hopefully not a more accessible, but it might be a way for them to access care. But I would hope that MAID would be a last resort. But in our healthcare system, with so many staffing shortages and inaccessibility to like mental health care supports, I don't know if like everyone's gonna get the supports they need before they seek like MAID as an option.
I know, you know what, I've lived a lot of privilege in that, and in terms of healthcare, like one of honestly the luckiest things is when I was coaching basketball early on in in Saskatoon. I happened to become really close with one family, and the mom was a family doctor. So then I had a family doctor who, she took me on as a patient then after. So I've been like extremely lucky with the medical care that I've received, and I know that that's not the case for a lot of people.
I haven't had to interact with it as much as a lot of other people, so mine are actually fairly positive. Like I've had to go in for surgeries, wait time were pretty short, and it wasn't an emergency, and I got out. But I grew up in the healthcare system with like, I have cerebral palsy, so I was in and out of the hospital the whole time, and I always felt pretty welcomed. I even remember they're really good to kids. So since it is story time, I was like my first surgery, I was in kindergarten, and I remember like sedated. What they did is they lengthened my Achilles tendon for my leg. They brought me in a Super Nintendo with a TV. This is back in '98, pretty sure that's when it was. And so I was playing like Mega Man. I felt like I'm like, this is kind of cooler than home right now.
Yeah, I guess when I was in grade 7, I got really sick with something. They didn't know what it was, but I was in the hospital for about 4 days, and it was, I mean, everyone was very nice. I don't know what else to say. people were kind. Yeah, at one point there was like a pastor guy that came in and was like, you shouldn't be reading these. He took like, I had magazines with like electric guitars on the front, and he was like, this is bad. And I was like, get out of here. Other than that, I mean, I don't know. No, it seemed fine. Okay.
I don't know if you know this, but I have a long-term medical condition. I was born with it, and I'll have it until I die. It's called CAH, or congenital adrenal hyperplasia. And so congenital just means that it's a birth defect. Adrenal means that it has to do with my adrenal glands, which are right beside your kidneys. It sits on top. And then hyperplasia just means something's wrong with it. And so because I had kind of this weird, it is a weird medical condition. It's pretty uncommon. I spent a lot of time in the medical system growing up. And I got to see the lack of pediatric doctors that we have in Saskatchewan. So for example, for my condition, and for any kids who had diabetes. So my doctor also takes care of kids with diabetes. Yeah, it seems kind of like it's a weird combo, but the body is a weird thing. So in all of Saskatchewan, to deal with any of the kids who had my thing or diabetes, we could choose one doctor. So even as a kid, I would have to drive up to Saskatoon once every 3 months. So I lived about 3 hours away from Saskatoon. So as a kid, I didn't really think about it, but as an adult now, I can imagine even the financial burden of having to drive a kid 3 hours one way to go see a doctor every 3 months could be an issue, even though the act of actually seeing the doctor was free, right? In Canada, we are pretty lucky to have free healthcare, and I really appreciate that, and I love it, and I'll praise our healthcare system anytime that I really can. I think that we're on our way to being equitable, but I still see issues like only having one pediatric specialist in a province, where people have to drive really, really far just to access your services, as like something that we could still work toward, to have healthcare be more accessible to everyone.
Do you know, I've had both experiences in the healthcare system. I saw a doctor actually over last weekend, and when she found out I was a teacher, she was really empathetic about our contract situation, and you know, she said, we really support you guys, and you know, we hope that you know, everything works out good for you. And she took the time to get to know me, and that was really good. Because as an Indigenous person, I've also had really negative experiences in the hospital as well. And, you know, that judgment piece of painting everybody as being unfit parents, or, you know, there because you're drug seeking. An example would be when my youngest son had pneumonia, and he was put in the hospital, and he was put in an observation room, which means he has a quiet, private room by himself. And when the doctor came in to talk to me, he started talking down to me really condescending, and I just kind of looked at my husband, and he looked at me, and then the nurse jumped in and she said, no, don't talk to them like that. These are good ones. And she meant that we were good Indigenous parents, and that we were educated and we took care of our kids. And, you know, that really impacted my opinion on healthcare, and that's why I think it's really important that they get to know their clientele and that they don't judge them, regardless of whether they're a good parent or not, right? Everybody is due to that, everybody is entitled to that same level of professionalism and that same quality of care. Regardless of whether they're struggling with addiction or mental health or, you know, any other listed kind of trauma that as Indigenous people we go through. And so that really did give me a different outlook on our healthcare system.
So what healthcare is to me is making sure people have the right staff, like the right people and the right tools and equipment to treat existing conditions, to prevent future conditions, and to keep people safe. So that last comment comes from, like, we might not necessarily have a complete medical condition, but let's say there's someone who OD'd one night and had to come into the hospital. Okay, now we can help that person out appropriately. So I think it's just really making people be healthy in a genuine sense. I really think of the medicine wheel actually quite a bit. I'm like, if we can believe in the philosophies of the medicine wheel in healthcare, I think we'll have it figured out. So I think that's what healthcare kind of is, but what it should be is, I think we should really take on, okay, are they emotionally healthy? Are they mentally healthy? Are they physically healthy? Okay, now you're healthy. So I really think healthcare really should be more expansive, which I like how mental health is being included into it now.
You know, healthcare is, in Saskatchewan, thanks to Tommy Douglas, is a service that we can utilize and not have to go and pay for per time that we go. I mean, tax dollars and you know, money does go into our healthcare, but we as Saskatchewan residents don't have to pay for it. And so I think we're really lucky that we have that availability for us to be seen when we're sick. So for me, healthcare is, if you're struggling, you know, mentally, physically, emotionally, that should be available to you. And it's unfortunate that, you know, a lot of our smaller centers don't have those resources. So, yeah, I can honestly say that I think our healthcare is good if we can properly staff it.
Okay, so first, I think like healthcare as as an individual. So when I think healthcare, it's like going to the gym or getting outside, going for a walk, keeping my body moving. It's also healthcare for me is eating healthy. Again, I know those take monetary. There's a lot of like money involved in those ideas. Healthcare for me also is having good friends, and making positive connections and making healthy choices. So I don't smoke, I don't drink a lot, like things like that for me is healthcare. Then if I get to a point where I need to seek medical help due to an illness, like I did seek medical, just like a walk-in clinic one day for my anxiety, and so they helped me with getting on a medication. So then I would consider that healthcare if I broke my leg or anything like that. Actually, I need shoulder surgery, so I would seek healthcare for my shoulder, but also that's like physio and massage therapy to try and maintain my health for my shoulder, say before I get that surgery. So I think healthcare is like a wide range of personal, personal and seeking professional support for your health.
I'd say healthcare is like an essential part of any society, and like healthcare is really like at the heart of like any community. It, like depending on what kind of healthcare you receive, that's gonna like make a big impact on like the society you live in, the people you know in your life, like and like healthcare are the people that take care of are meant to take care of your loved ones, your friends, like everyone you know, yourself, and it's a huge important part of the world.
What is healthcare to me? Healthcare to me means that everyone is able to receive what they need when they need it or at a reasonable time. Healthcare means communal care and community care, meaning that we are putting more effort into kind of taking care of each other, preventing a lot of things before they become hospital visits. Healthcare just means that it's a little bit more. Healthcare to me means accessibility, I guess. It has to be accessible to everyone. Otherwise, it's not really healthcare. It's just a privilege thing, right? And everyone has a body that needs to be taken care of. So I think we all deserve at that same level